Hello there, welcome to another edition of Talk on Nevada. I'm Andy Matthews. Healthcare reform, what once seemed a done deal, now seems to be very much up in the air, and that's the subject of this week's show. Geoffrey Lawrence, fiscal policy analyst at the Nevada Policy Research Institute, is my guest. Jeff, welcome.
Thanks, Andy. It's good to be here.
All right. Rasmussen came out with a poll recently that shows that public opposition to healthcare reform, the legislation that's making its way through Congress, opposition is up to 53%. That's up from about the mid-40s less than a month ago. What's driving this growing public concern over the healthcare bill?
Well, I think there's a number of things. First of all, is simply the cost estimates. Cost estimates for this bill have ranged between more than $1 trillion and all the way up to $4 trillion over the next 10 years. And that in itself is enough to give many people pause over this bill as they're considering it. The current entitlement programs that the federal government has, such as Medicare, Medicaid, Social Security, are already in danger of becoming insolvent. And so creating this new system of entitlements is just going to add to that problem. And so there's a significant reason to be concerned about this.
Now, one other thing that Rasmussen has found in his polling, and I think there may be a link here, is that 25% of Americans are saying, only 25% of Americans think that the stimulus package has had a positive effect on the economy. Is there a link there? Is that part of what's driving this opposition to health care?
Well, yeah. I mean, over the last several months, for example, with the TARP bailout bill, as well as the stimulus bill, there's been in excess of $1 trillion being spent at the federal level, and there's kind of a general perception that that really hasn't done anything to help the average American, and so now people are looking at this healthcare bill and expressing real doubt about whether or not that will be beneficial. And so, if all the spending is going through and it's not helping anyone out, then that's it's giving people a reason to think twice about this.
Now, I want to get back to the first point that you made, that a lot of what's driving up these negative numbers on healthcare reform is the fact that people are getting more familiar with the bill, and they're not liking what they're seeing. Now, there's been a real point of contention here. The president has said repeatedly, he's been adamant about this, that if you like your current health insurance plan, you get to keep it. It's not going to change. And now opponents of this proposal actually say, no, that's not the case. Who's right? How can we sort all this out?
Well, basically, you get to keep your own plan under this proposed bill, only if it meets the government's approved standards of what type of coverage should be included. So if you currently have a plan and you're satisfied with it, and it doesn't meet the government standards, then you'll essentially be forced into the public option plan. And so that's this myth about whether or not you'll be able to keep your own plan is kind of diluted. And there's significant concern as well that the public option plan will eventually drive out private insurance companies from the market, and because they're competing on an unfair playing field, basically. And so this government monopoly would take away people's choices, and you'd eventually be forced into the government's plan.
Two other things that the president has been talking a lot about is cost and quality. And he says that both are going to get better under this plan. Costs are going to go down and quality is going to go up. And he says that by introducing this public option, he's going to infuse some competition to the system that's really lacking it. Now, he's appealing to people like you, the fiscal conservatives, who say we need more competition. It sounds like a win-win. Better quality, lower cost. What's not to like about this? Well,
essentially, that's actually kind of that's not really true, because there's not going to be more competition, because the public option plan will be competing on an unfair playing field, and it's going to eventually drive out these private insurers. So what you're going to see is less competition as we move towards a government monopoly for health insurance. And so as you move towards this new lack of competition, it's very possible that quality will go down significantly, because people just don't have an option about going outside of the government plan. And this it's also going to impose huge new costs. As I said, estimates that are upwards of $4 trillion in some cases for this new plan, because as you're as you expand coverage, and in many cases, you're forcing people to accept coverage that may be in excess of what they really require, and that's going to force new costs onto the system and necessarily lead to either higher tax rates or to a government rationing of healthcare, and likely a combination of the two.
Okay, Jeff, I'm putting you in charge of healthcare. Okay, you get to call the shots now. How do you accomplish these things? How do you improve quality? How do you bring costs down? There seems to be at least some consensus, even among a lot of people on the right, that there are some inefficiencies, there are some problems with the system as it's currently structured. It can get better. If you're in charge, what are the options if this current proposal isn't it?
Well, there are significant problems with the healthcare system as it's structured now, but this proposal in Congress would move in precisely the wrong direction. The right direction would be to improve competition and improve the function of the market in the health insurance industry. Currently, each state has a regulatory structure that restricts individuals from going outside of the state to purchase a health insurance plan that may be more suitable to their own needs and may be more price competitive as well. So basically what we have is a system of either 50 monopoly insurance providers or at least an oligopoly where there's only 2 or 3 providers, and there's not really a competitive functioning system. A much better option would be to open up that market, and allow market forces to work like they do in other insurance industries, like car insurance, for instance. You can buy from nearly any provider, and those costs are much more affordable for the average person.
So how is this all going to play out? Obviously, I talked earlier in the show about the growing public unrest. Is this proposal or something very similar inevitable, or is there a chance that this may actually fall apart?
Well, there's been a lot of recalcitrance recently among congressmen because they're starting to look at these cost numbers, and they're becoming less convinced that this plan will actually improve quality and quantity of healthcare, and there's a track record of big spending measures going through Congress that people generally have, at least they perceive that they haven't been successful in achieving their goals. So all these congressmen are now feeling pressure from their constituents, and
there's a lot of Democrats.
Yeah. For example, here in Las Vegas and Nevada, Dina Titus was one of these Democratic congresswomen who is now expressing some opposition for this plan.
A lot of these swing district Democrats who represent a lot of more conservative voters. But Jeff, we're going to have to leave it there. We're going to continue to watch this. I know that you will. I want you to keep watching us here on Talk on Nevada. Thank you for tuning into this week's show. We'll see you next time. NPRI.org is our address on the web. Check us out for more information on the healthcare debate and more private solutions to public challenges facing our Silver State. Thanks. We'll see you next time.